I'm Maya.
And I'm Lexi.
We are students from TCU in the Sex, Gender, and Disciplines class, and this is our presentation for the YWCA on women's health. We're going to give you some information about Pap tests, mammograms, birth control coverage and options, and also some local resources where you can get free or low-cost women's health services.
We will first discuss Pap smears. A Pap smear is also known as a Pap test, and it is a procedure to test for cervical cancer in women. It is recommended for women ages 21 to 65, whether or not the woman is sexually active. If you've never had abnormal tests from a Pap smear test, you only need to get a test every 3 years. If you've had abnormal results from a Pap test, you should get tested every year. It is important to get routine Pap smears because it can detect many STIs and can save your life by early detection of cervical cancer. One way to protect yourself from cervical cancer is by having the Gardasil vaccine, which is a 3-shot vaccine that protects you from HPV 6, 11, 16, and 18. The CDC recommends Gardasil for boys and girls starting at ages 11 to 12 up until 26. Getting the vaccine young is crucial because 50% of the diagnosed HPV cases are between the ages of 15 to 24-year-olds. A mammogram is an X-ray of the breast that generates pictures of the breast tissue and can detect and evaluate breast changes. A mammogram can also locate tumors that are too small or too deep to be found by the breast examination. If a mammogram reveals an abnormal area, a biopsy may be performed to determine if it is cancerous. This method is 84% accurate and is the most effective way in detecting breast cancer. It is recommended that you get a mammogram every year starting at age 40 and every 2 years at ages 55 to 70. During your mammogram, you should avoid any topical lotions or deodorants around your breast area because it could interfere with the X-ray. The X-ray itself takes about 15 minutes and your breast is placed in between 2 metal plates. And most women say that it is just uncomfortable pressure and to avoid getting a mammogram when you're experiencing breast tenderness from your period. You will receive the results depending on the clinic, but anywhere from at the time of the mammogram up until 2 weeks.
Now we're going to talk about birth control. Thanks to the Affordable Care Act, also known as Obamacare, most insurance is now required to provide one form of birth control in each category for free. And we're going to talk about the birth control categories here in a little bit. Now, if you don't have health insurance, there are still options available to you. There are several clinics in our community that offer resources for little to no cost, and you can check on our resources handout for those clinics. The first type of birth control that I'm going to talk about is oral contraceptives, also known as the pill. The pill remains the most popular form of birth control in the U.S. And some advantages to taking the pill are that it regulates the menstrual cycle because it is a form of hormonal birth control. It's 99% effective if taken properly, and taken properly means taken at the same time each day. It can relieve cramps, reduce acne, and even possibly reduce ovarian cysts. Now, the downsides to this are that the pill does not protect against STIs or HIV, and as I mentioned, you have to take the pill at the same time every day for it to be 99% effective. And it can have some pretty serious side effects, including blood clots, kidney, liver, or adrenal dysfunction, high blood pressure, and even others depending on the brand of the pill. And you have to be aware of how other medications interact with birth control. Antibiotics in particular are known to make oral contraceptives ineffective. The next is the intrauterine device, or IUD, which is, there are 2 different kinds. There's a copper IUD, known as the Paragard, and then a hormonal IUD, known as the Mirena, and these are, as they say, put into the uterus. Now, some pros of the copper IUD are that it's non-hormonal, so you don't have the side effects that you normally see with hormonal birth control, like mood swings, weight gain, and it can be in place for up to 10 years. However, there are some disadvantages to the copper IUD. It's not recommended for women who already have heavy or painful periods because it can actually make those symptoms worse. It doesn't provide protection from STIs or HIV, and insertion can be uncomfortable. Women also have to routinely check to see if the IUD is still in place because if it moves or comes out, it's no longer effective. Now, the Mirena is also 99% effective in preventing pregnancy, And even though it is a hormonal form of birth control, it's a low hormone dose, so you see less of the symptoms of weight gain and mood swings that you see with things like oral contraceptives. It can be in place for up to 5 years, and it may make periods lighter, less painful, and even less frequent. A lot of women report not having a period at all when they start a hormonal IUD. Some downsides to hormonal IUDs are that, once again, it does not protect from STIs or HIV. You have to check to see if it's in place, and it can be uncomfortable when it's inserted. The birth control implant, also known as Nexplanon, Implanon is being phased out and is no longer going to be used anymore, is another form of implantable birth control. It goes into the arm, and it is a form of hormonal birth control. It's good for 3 years, and like the IUD, it's a low-dose hormonal contraceptive. It can reduce period pain, frequency, the duration of periods, and the amount of bleeding. However, removing it can be painful because scar tissue can develop around the implant. And as I've mentioned, like all non-barrier methods, this form of birth control does not prevent STIs.
If you find yourself in a situation without any of the prior preventative birth control options we've discussed, emergency contraceptives can save the day. Some brands of emergency contraceptives include Plan B, Levonorgestrel, Next Choice, and Ella, and they usually run anywhere between $35 and $60. And it is noteworthy to say that the generic brand is less expensive and equally effective for up to 72 hours after unprotected sex. Some advantages of emergency contraceptives are that they prevent pregnancy after sex, and they don't interfere with an established pregnancy. However, they do have their drawbacks, which are that emergency contraceptives protect you from a singular contraceptive of emergency, and some possible side effects may occur, such as nausea, fatigue, delay in menses, bleeding, headache, and breast tenderness. However, most of these side effects are short-lived. If you want to remove the thought of pregnancy altogether without the stress of what birth control method to use, there are 2 forms of sterilization that are available: Essure and tubal ligation. The first, Essure, is where a small insert is permanently placed into each of your fallopian tubes by your doctor. These inserts work with your body to form a natural barrier that keeps sperm from reaching the eggs, preventing pregnancy. While the natural barrier forms over time, another form of birth control must be used. Some advantages of Essure are that it doesn't involve surgery, it is a permanent contraceptive, there is a quick recovery, and no hormones are involved. Despite this, some disadvantages are that it requires additional birth control for 3 months after insertion. Insertion can be painful, and post-sterilization regret may occur. The next form of sterilization, tubal ligation, is what some people refer to as getting one's tubes tied, and it is a surgical procedure in which a woman's fallopian tubes are clamped and blocked in order to prevent eggs from reaching the uterus for implantation. Similar to Essure, it is a permanent contraceptive, it is non-hormonal, and post-sterilization regret is possible. But additionally, it may reduce the risk of ovarian cancer. Tubal ligation is also different from Essure in that it requires surgery and there is a recovery period from that.
And here we have a list of contraceptives that we encourage women to avoid. The first is Depo-Provera, also known as the shot, which it is convenient because you get 1 shot and it lasts for up to 90 days, but it can have very serious side effects, including loss of bone density, heavy weight gain, extreme mood swings, and sterility. Next is the NuvaRing, which, like most hormonal birth control, has a risk of causing blood clots, but it appears that it has a much higher than normal risk of causing those blood clots than other forms of hormonal birth control. And last is withdrawal, or what we know as the pull-out method, and we discourage this one simply because it's ineffective. It is possible for a woman to become pregnant even if the man does not ejaculate inside of her. And here we have a list of local resources available, but please take a look at our PDF for a more complete list.